is our 8th webinar in a series of COVID-19 programming that we are working with our membership and community to bring to all of you. The topics that we've had have ranged from various topics, including the CARES Act to health and wellness, as we work in a remote environment. This webinar has been a series of collaboration with our regional chambers of commerce, NEPA Alliance, and Lesson Alive. I'd like to mention our participating chambers, which include the Wilkes-Barre Chamber, Pittston, Greater Carbondale, Greater Hazleton, Chamber of the Northern Poconos, Back Mountain, Wyoming County, Pike County, and Schuylkill Chamber of Commerce. To let everybody know that this webinar is being recorded and it will be posted following the presentation to the Chamber's resource page at www.scrantonchamber.com/important resources. Our presentation today is from Joe Soleo of McNeese, Wallace, and Nurek. Joe is an experienced practitioner in labor and employment law. He has exclusively represented both private and public employers in labor and employment matters since his admission to the Pennsylvania Bar in 1993. Joe regularly counsels and provides day-to-day advice and training to employers in all industries with respect to employment-related issues, and he helps and encourages employers to maintain a proactive and a preventative approach to employment law compliance to reduce potential liabilities and avoid costly employment-related claims. At this time, it is my pleasure to introduce you to Joe Soleo. And Joe, are you ready to proceed?
I am. Good morning, everyone. I'm happy that you were able to join us this morning at this difficult time. I hope you're managing both in your personal and professional lives at this, unprecedented circumstance. We're going to talk this morning about the Families First Coronavirus Response Act. We know that in human resources and labor law, we love acronyms, and that's known as the FFCRA. If we can go to the next slide, please. So the key provisions of this act, they provide two paid leave provisions. One is emergency paid sick leave, and one is emergency family and medical leave. And this act became, it was signed into law March 18th. It became effective on April 1st. And now, that was some time ago, but this is still of quite interest to employers and businesses because even though it went into effect April 1st, it obviously was implemented due to the circumstances very, very quickly. Guidance has been issued and developed in more detail over time. And we also know that, a lot of employers are not operating right now or not operating at full capacity. And as we anticipate in the coming weeks and months that more businesses will be opening up and operating, those businesses may not have had to deal with this particular law on any type of a regular basis. And as again they begin to do more business, then this law may impact them more, and they may have to do more administration with respect to it. And the law will continue in effect. There's a sunset provision where it will automatically expire as of December 31st of this year, unless it is renewed. And it's possible that the law's provisions will actually become ineffective earlier than that. That depends, of course, on whether or not the national declaration of emergency over this pandemic, if that goes away. And right now we can probably anticipate that that's not happening anytime in the foreseeable future. So, we can anticipate that these provisions are going to be in effect through the end of the year. So we're going to talk in a little bit more detail as we get into more of the presentation about who is a covered employer. A little bit of the nuance of that, but for right now, I'm going to assume if you're on the phone, you probably know you're a covered employer. But again, just as a shorthand right now, we will say that most employers that have less than 500 employees, if they are private employers, including nonprofits, are going to be covered. And if you're a public employer or a public agency, most of those businesses are going to be covered regardless of the number of employees, even if you have 500 or more employees. So again, I'm mentioning that now because we're going to get into to discuss right now the notice requirement. Just like with many other employment-related laws, both federally and in Pennsylvania, employers are required to post certain notices for their employees. There is a notice requirement for the FFCRA as well. And so effective April 1st, when the law went into effect, each covered employer must post a notice. Now the notice is available. We have the link right there where to get the DOL published notice poster. It's just a one-page notice. You can just print that out. There's nothing fancy you need to do with it. You can just print that out for free, and you need to get it posted in your workplace. Now, because we're also in some unusual times right now, and there are a lot of people working from home, doing telework, or you may be an employer that has remote work sites, and sometimes employees don't report to one location. Then in that case, and because this law was rolled out very quickly, there is flexibility built in with respect to the notice requirements, and you can satisfy the notice requirements by either sending notice electronically or by mail for those employees, again, that may be working at home or working at remote locations. And there's also a very helpful, on this slide you'll see at the bottom, there's a very helpful question and answer publication by the DOL that relates specifically to the notice. So again, these are, and it's not very detailed. Those are things that are worth taking a look at. So let's get into the first, paid leave aspect of the FFCRA. And the technical name for that is emergency paid sick leave. And that's available to any employee on the payroll. So note that there's no waiting period. It's not, it doesn't have to be an employee who's been with you for 30 days, or like the FMLA, it doesn't have to be an employee that's been with you for a year. Immediately upon date of hire, regardless of the length of tenure of an employee, they're eligible for this particular benefit. It provides paid sick leave benefits to employees unable to work. Now, unable to work includes both physical in-presence work, and it includes telework at home. So in order to be eligible for this benefit, the employee must be unable for one of these reasons to work, and that includes telework at home if an employer makes that available. And there are 6 reasons, and it's important to keep these in mind because it's very specific, the reason, the eligibility reasons for this leave. And we're going to stay on this slide for a little bit. So there are technically 6 reasons. They're listed there. Really, there are 5 substantive reasons. If you look at this, you'll see reasons 1 through 3 actually are specific to the employee themselves. And we're going to talk about them a little bit. Reasons 4 and 5 have to do with specific to another person, either the employee's child or a family member or a household member. And reason number 6 is a little bit of kind of a technical, it's kind of a generic contingency reason. And that basically is built-in flexibility if Health and Human Services, in connection with the DOL and Treasury and other departments, determines that, again, in this unusual circumstance, there is some other reason that it similarly warrants application of these benefits, then by rule or regulation, that government agency may designate that there's one or more other reasons that this leave would be an entitlement. And that's not been implemented at all at this point, and so we don't really need to worry about that. But, like everything else in this area at this time, keep an eye on any guidance or new guidance that may be issued. So let's talk a little bit about these reasons, and we'll stay on the slide. So the first 3 reasons, as I said, for when an employee may be eligible for this emergency paid sick leave have to do with the employee's own circumstance. So the employee is subject to a government quarantine or isolation order, is number 1. Number 2, the employee has been advised by a healthcare provider to self-quarantine. Number 3, the employee has symptoms of COVID-19 and is seeking a medical diagnosis. So let's talk about them a little bit. Actually, I want to talk about 3 and 2 first, and in reverse, because just logically and in a chronological sense. So 3 is designed if an employee has symptoms, and we all know kind of the general symptoms. They just expanded those, but the basic symptoms have been somebody has a fever over, I think it's 101.4 or 100.4. Somebody has a dry cough. These types of things. If somebody has one of the recognized symptoms of COVID-19 and they're seeking medical diagnosis, then this leave entitlement could come into play. And if you think about this logically, again, there's a good reason for that. Obviously, if somebody is having these symptoms, we don't want them in the workforce. We want we want them to seek medical advice and at least initially be home to figure out what's going on to help with the spread of the virus. So, if you have an employee who basically calls and says, I'm having these symptoms, I don't feel well, I'm going to call my doctor, or they're asking you what to do, the advice should be, well, stay home, do not come into work until we figure out what's happening here, and you should consult with your doctor. Now, under the circumstances right now, again, there's designed to be flexibility here and a little bit of on your honor system, because I think we all know a lot of people don't want to be running to the doctor right now. Number one, because that's where potentially people that are sick are, and where people with the virus may be. So that's a risky place to be in and of itself. And number 2, a lot of the systems, including the healthcare system, are overburdened right now. So, a lot of things with, at least initially, with healthcare providers is being done by phone or remotely. If an employee is in one of these circumstances, again, the idea is that they're removed from the workforce, they're given the ability to be out, at least initially, to seek a medical diagnosis. So that's kind of step 1 of that process. Now, if you go to reason number 2, that's kind of the next step. So if you have an employee who is having symptoms and maybe seeking a diagnosis, 1 of 2 things is going to happen. The employee is going to get a diagnosis that it was not COVID-19, it's potentially something else, maybe the common cold, or maybe it was nothing at all. At that point, the need for leave would be over. So the first part of that leave under number 3, the employee may have been out for a matter of a few days. And then and until they get their diagnosis. So if the diagnosis is they don't have COVID-19, they're cleared to come back to work, that leave may have been for a very short period, and then they come back to work. If the employee, if the doctor says you likely have COVID-19, probably there's a reasonable enough chance that you have a COVID-19, or that you do have COVID-19. And my advice to you is you need to quarantine for the recommended period until we can either clear you or, to the 14-day period, whatever it may be. If that's the case, then that employee will be entitled to continuing leave under the paid sick leave provision. Now, not because they're having symptoms and seeking a medical diagnosis, but now because the employee has been advised by a healthcare provider to self-quarantine. And, in that circumstance, you can get information from the employee, to provide a note if they can get one, or to provide information on their provider and what the recommendation was. So that's kind of the most common. Those are the 2 common eligibility areas that under this law that you as employers or human resource professionals will likely be dealing with. Number 1. When you first read number 1, you kind of look at number 1 and think, wow, that's really broad, because there are a lot of orders out there. There's the stay-at-home order, there's the business shutdown order, except for essential businesses. So almost everybody's going to fall within the category of number 1. And quite honestly, that is, it's really not the case. Actually, number 1 in application turns out to be very narrow. And that's because if you look at the regulations that have developed, and I should mention that the Department of Labor, the IRS, if you go on if you go on the internet and you Google, CCFRA, guidance, DOL, question and answers, there are a number of official guidance pieces out there that are helpful to help interpret this. But number one, basically, the way that's been interpreted is an employee would have to be out of work, unable to work or telework, specifically because of a government quarantine or isolation order. Now, in Pennsylvania right now, again, we have the stay-at-home order, and we have the business shutdown order, basically, but there are quite a few exceptions with those things. Obviously, if you're an essential business that you're allowed to still operate, well, then you're not unable to work or telework due to a government quarantine or isolation order. So you would not be entitled to this benefit. Similarly, what the guidance says on these things is, if your employer lays you off because of the government quarantine or isolation order, so the business says to its employees, look, because of reduced business demand, or because we're not an essential business, we are basically shutting down right now, and we're temporarily laying everybody off, and we intend to call people back when and if we can, and it's safe to do so. What the regulations say is these employees are no longer home because of the government quarantine or isolation order, or the shutdown order, or the stay-at-home order. They're at home because the employer has laid them off because of these things. So it's a little bit of an odd nuance, but an important one. So if the bottom line is, if you're laid off as an employee because of because of the circumstance, you would not be entitled to this benefit under reasoning number one. So it's going to have really limited application, actually. So those are the first three reasons. Again, you're going to be dealing mostly with 2 and 3. Number 4 is if an employee is caring for a relative who is in quarantine or isolation. Let's change that, if you will. Make a mental note or a note on your papers. Rather than relative, substitute individual. But let me make it clear that it must be an immediate family member or someone who has a special relationship to the person who is caring for them, or they must regularly reside in the household. So in other words, like you can't just this isn't just taking care of anybody. This would typically have to be a family member, someone residing in your home, or potentially something where you're a guardian of somebody, or someone like that. And so you would have to, as an employee, show that there is someone that falls within that category who is in quarantine or isolation, either by government order or by medical recommendation, and you have the responsibility to care for them. In that circumstance, that employee may be entitled to this 2-week paid leave as well. And the last requirement, as an employee is unable to work because their child's school is closed, or childcare service is closed or unavailable due to healthcare emergency. Now, as we know, all the schools are closed right now, and many of the childcare services are closed. So if you have an employee who says that they can't work because of this reason, then you will need to get the information from that employee and make a determination as to whether or not they would qualify. Now, let's remember a few things. First of all, if telework or homework is available to the employee, and the employee can perform telework with caring for the child, then they wouldn't be entitled to this benefit. The other circumstance to keep in mind is that, excuse me one second. A question that was initially very much up in the air, which has now been answered, is the employee, to be eligible for this benefit, it has to be necessary for that employee to provide the child care. So if there is another child care provider available, a husband, another parent, another guardian, then you can't have more than one person that is entitled to this benefit. So that's a question that could be asked at the time of the leave request is made. We can go to the next slide, please. So the amount of emergency paid sick leave. So the rule is that a full-time employee is entitled up to 80 hours, okay? And the requirement that it is hours is important in how it's administered. So, and a full-time employee for the purpose of this act is defined as an employee who is normally scheduled to work 40 more hours per week. So it's up at a high hour threshold. So anybody who's at 40 or more hours regularly scheduled is a full-time employee. So how does it work, the 80-hour requirement? So let me just use a few examples. If you have an employee who regularly works 40 hours per week, well, that's easy. So they're going to be entitled to 40 hours for the 2-week period, and capped at 80 hours, and that's how that would work. Now let's look at if you have an employee who regularly works 45 hours per week. They normally work built-in overtime, 45 hours a week. So the way it would work is that employee would be paid 45 hours in week 1, and then in week 2, they would normally be scheduled to work 45 hours, but remember that this benefit is capped at 80 hours in a 2-week pay period. So in week 2, they would be paid for I'm sorry. Did I lose connection?
You're good, Joe. We can hear you fine.
Oh, okay. I'm sorry about that. All right, there we go. I had a call come in, and I'm going to shut my phone off right now. The second week, the employee would be paid 35 hours because that would take them to the 80-hour total. And we're going to talk a little bit about how the pay works, because overtime is built in a little bit to that formula. And we'll show you how that works. Now, for a part-time employee, it's up to the number of hours of leave that the employee normally works on average for a 2-week pay period. So, again, if it's a regular schedule, it will be pretty easy to determine. If you have an employee, for example, who works 35 hours a week on a regular basis, well, then they're going to be entitled to a total of 70 hours in a 2-week pay period. If you have an employee who has a fluctuating schedule or an unknown schedule, it's going to be the average of hours that they work in a week, based upon determining an average over the last 6 months of pay. So let's talk about the calculation and use of the benefit. The amount of pay depends upon the reason for the leave. So if it is for one of the first 3 reasons that we talked about previously, for the employee's own condition, then the employee is eligible for up to 100% of their regular pay rate, capped at $511 per day.
I didn't get that.
Or a total of $5,110 over the 10-week pay period. If it's to care for a family member subject to quarantine or isolation, or a child care issue due to school closure or child care unavailability, then it is 2/3 of the employee's regular pay, up to a cap of $200 a day, or a total of $2,000 for the full 10-day leave period. An employee may first use available EPSL before any other accrued leave. So in other words, an employer can't require an employee to burn their regular sick time first. or other paid time. The employee is allowed to access this paid benefit first and preserve their other paid leave. There is no availability of this, does not get banked. It can't be used after the pandemic and emergency declaration are over, and there's no carryover or payout. This is a benefit only for use during the time of the emergency order regarding the pandemic is in place through the end of the year if it lasts that long and under one of the eligibility circumstances. The leave is not to be used intermittently unless under certain circumstances and if the employer agrees to it. So let's go to excuse me for 1 second. I'm sorry for the brief interruption. I had to leave the room and shut off my phone because it was interfering with the presentation. But thank you for that. So there's also a bit of a nuance in terms of calculation of the. If we can go to the next slide. There's also a bit of a nuance regarding how you calculate the rate of pay. So unfortunately, it's not as easy to say, okay, you know, Joe makes $15 an hour. So if Joe is entitled to 40 hours in week 1 and in week 2 of this benefit, then all we need to do is take 40 hours times $15. It would be nice if it were that easy, but it's not really that easy. The regular rate of pay for the purpose of the FFCRA is basically the average of the employee's regular rate over a period of up to 6 months prior to the date on which the leave is taken. So if the employee has worked for you for 6 months or more, you basically take an average of what they paid, of what they were paid over that 6 month period. You boil it down to a weekly average. You can boil it down to a daily average, actually, and then that's what the employee is entitled to for each day that they're out. So what that does is that actually bakes in overtime and extra compensation, right? So if I get paid $15 an hour, but you look at over the last 6 months of my average pay, and if I work overtime at some times, if I'm given bonuses or other things, that money is going to get baked in, and now my average rate of pay is not going to be $15 an hour. It's going to be $15 plus, presumably. Or if I've taken, a lot of time off, it could be less. But in any event, you're going to come up with that. You're going to come up with that calculation, and then that amount is what's going to be used to pay the benefit. So one other thing about overtime. Remember, I gave the example before that if you work, if the employee normally works 45 hours in a week, that they would be paid the 45 hours in week 1 and the 35 hours in week 2. Well, remember I just said that the overtime is potentially baked in if an employee normally works overtime because that overtime pay is going to be kind of baked in to determine the hourly rate. But nonetheless, when it comes time to pay the benefit, if an employee in 1 week has over 40 hours that they're due, you're not going to pay time and a half on that. It's going to be paid at the straight time rate of the average rate that you determine by the 6 month calculation. So the overtime again is kind of built into the rate of pay, but you don't pay it time and a half. You pay all hours at straight time under the FFCRA. And so let's go to the next slide. So the next slide is the paid family leave portion. So this is an expansion of the Family and Medical Leave Act, but don't think of it as being an expansion in terms of it broadens the normal reasons for FMLA leave. It's an extension of the Family and Medical Leave Act, but only with respect to one particular issue. So it provides for a total of up to 12 weeks of leave For employees who cannot work, and remember that includes telework, because their minor child's school or child care services is closed or unavailable due to COVID-19 precautions. So notice that this one reason for this expanded paid, I'm going to call it family leave, right? Because it's not really medical leave, but the paid family leave provision is similar. It's the exact same as one of the reasons, reason number 5, that you can take, the employee can take up to the 80 hours of paid sick leave, okay? But it is the only qualifying reason for the 12 weeks of addition of this new family leave. It's the only reason at all. So applies to an employee. Now, this is also an interesting distinction. It applies to employees who have been on the payroll for 30 days. Remember, we talked about the emergency paid sick leave benefit. That was, there was eligibility for any employee immediately upon date of hire. This benefit is only available to employees who have been on the payroll for 30 days. Again, intermittent use is very limited. The employer basically has to agree to that. Let's go to the next slide. So the way the paid provision of this works, there's an interrelation between the new paid family leave and the emergency paid sick leave. For the first 2 weeks of the emergency paid sick leave, it is unpaid. However, the employee can use the emergency paid sick leave or substitute other paid leave at the same time for that first 2 weeks. For the remaining 10 weeks of the 12 weeks of the new family leave, the employee will receive 2/3 of the regular earnings up to a cap of $200 per day, or $10,000 total. So that's the same calculation for the emergency paid sick leave up to the 2 weeks or 80 hours. It's that same formula cap for this benefit, the lower amount. And again, it's a varying hour calculation for part-time employees, right? So if you have an employee who normally works 20 hours a week, that's what they're going to be entitled to. They're going to be entitled to their average pay at 20 hours, doing that regular rate calculation, but then it's capped. It's capped at this $200 a day, or $10,000 total for the 10-week period following the initial 2 weeks. We can go to the next slide. So let's talk about taxes. This is also an interesting twist on this, and this is important because the idea here for these benefits is that they're supposed to be fully funded by tax credits. So when an employer pays these benefits, this is what it needs to do with respect to tax withholding. So for the 6.2% Social Security tax, that will be withheld from the employee's benefit pay that they're going to get as a result of this. But the employer is not required to pay its 6.2% share of the Social Security tax. So it gets to pocket that and use that to fund its payment of these benefits. The employer likewise withholds the employee's portion of the Medicare tax, the 1.45%, and it also does pay its share of the 1.45% of the Medicare tax with respect to its overall payroll as it normally would. However, the employer will be able to claim that back as a tax credit when it files for its taxes. So it can capture some of the money right up front. It can capture some of the money right up front by taking it from withholdings that it would normally be required to remit. And if there's anything above that, it can apply for the tax credit. So that's how this is supposed to be funded. Let's go to the next slide, please. So here's the slide we were talking about early. So in the private sector, employers with fewer than 500 employees. So if you're an employer private with 500 or more employees, you're not covered by this law. Now, why? Well, it's essentially a large business exemption. And the idea is big companies like Amazon and Google, they're going to be able to provide these benefits without being required by law. Now, I'm not so sure of that, but in any event, that's the way the law was designed. Nonprofits are included within coverage. Again, if you have 500 or less than 500 employees. Public agencies and government employers are covered regardless of the number of employees. Let's go to the next slide. Now, there is a small business exemption, but it is a limited exemption. First of all, it only applies to employers that are under 50 employees. And here are the circumstances where the exemption could apply. So an employer has less than 50 employees, and it only applies with respect to the emergency paid sick leave benefit and the paid family leave benefit for the reason of an employee must be home due to a child being out of school, or the place of childcare is closed, or the childcare provider is unavailable. So we talked before about, the employee's own seeking medical diagnosis because they have symptoms, an employee's recommendation from a doctor, directive from a doctor that they must self-quarantine. Those issues, or if an employee is home to take care of an individual that they have a responsibility for, because that individual is subject to quarantine or isolation. The small business exemption does not apply to those benefit eligibility circumstances. But with respect to this one, the small business exemption does apply. There's no application process. A small business may claim this exemption if an authorized officer makes one of these determinations that it would basically be too burdensome. And the reason why there's no application process is, again, because they don't want to overburden the system right now. So what an employer should do is their authorized representative should make an analysis of this, make a determination and document it. And that's for the purpose of, if it's challenged later on, the employer may have to justify why they went in that direction. So, I would definitely be careful if you're gonna apply this exemption. Make sure that you do the analysis, make sure that you document it, and get some advice if you need to. You can go to the next slide, please. So, which employees are covered? So, emergency paid sick leave, all full-time and part-time employees are of a covered employer, and that's, again, less than 500 employees, and most public agencies. There's no waiting period. They're eligible for these benefits the first day that they're on the payroll. The expanded family leave, part-time and full-time employees who have worked for 30 or more calendar days. And there's a special rule there if not too much probably broad application here, but if a temp employee is converted to a regular employee, the time as a temp is counted toward the 30-day payroll period. Next slide, please. So there are two interesting discretionary exclusions that apply to healthcare provider employees and emergency responder employees. Now, I do want to try to clear up a little bit of confusion. There's a somewhat of a nuance here that does make a bit of a difference. This is not a blanket exception for an employer. So this exclusion does not say that a healthcare provider employee or an emergency a healthcare provider employer or an emergency responder employer, like an ambulance company or a doctor's office or a hospital, that they are completely exempted from this law. That's not what the law says. What the law says is, it goes from the other side of it. It says an employer who employs healthcare provider employees, who employs emergency responder employees, can, if they decide to, they can exclude those employees from coverage under the Act, and they can do it on a case-by-case basis. So the idea here is that because these types of employees, and the obvious examples would be doctors, nurses, ambulance crews, first responders, these types of employees may be very needed in the system to helping combat and prevent the spread of the virus. So employers can, in their discretion, decide to exclude these employees from coverage under the Act. What the law is designed to do is, I suppose an employer can, but that employer not across the board kind of say, okay, all you folks are excluded. It's designed to leave employers of these types of employees the flexibility to say, okay, we're going to provide the benefit at this time, or we're going to provide it to this employee, but we can't provide it to that critical employee. Or maybe we'll provide it at this time, but later on down the road, if things with the spread of the virus spike up very much, or you have certain circumstances where these employees are more needed, then that gives the employer the ability to say, we are going to exclude a particular applicant or a group of applicants from coverage. Now, again, as I read it, it doesn't necessarily prevent an employer in this area from kind of making a blanket pronouncement, we're not going to provide this benefit to our employees because we can exclude them. But it does leave that flexibility to do it on a more individualized basis. There have been some questions that we've had with clients as to, you know, which employees fall within this category. Again, there are some very easy examples that are, you know, provided by the guidance. If you work for a hospital, if you work for a medical school, if you work for a nursing facility, you know, and then you get into some interesting things, a nursing home. And then the question becomes, you know, are all the employees who work for the nursing home, can they be excluded? Or is it only like a doctor, a nurse, they can be excluded, but you know, the janitor and the front desk reception, they can't be excluded? Well, the regulations and guidance seem to suggest that the application of this is very broad, and that, again, we don't want to overburden the system by having people who work for these providers, even if they're not direct healthcare providers or emergency responders, you know, having the ability broadly for them to go out on leave and to kind of weaken the system or weaken these particular employers who may be critical in the chain of helping prevent the spread of the virus and to tend to people who are sick. So again, if you're an employer who may fall into one of these categories, that you employ these groups of employees, you certainly should be looking at, you may have already looked at, a lot of associations, a lot of industry or certain type of provider associations are taking positions on this and have, you know, done research and have issued certain memos on this type of stuff. So if you belong to certain industry groups, again, and you kind of fall within one of these target areas, you might want to, you know, you might want to look at that guidance and see what you're bound to in that regard. Next. So let's talk about record keeping. This is important for a few reasons. Again, there's designed to be some flexibility here because we know, you know, the law recognizes that employers are dealing with a lot right now, and that a lot of systems are overburdened. So so they don't. The idea is that things are you know, shouldn't be made too overburdening. However, there are certain things an employer needs to do to protect itself for a few reasons. Why? Well, documentation and record keeping become important because maybe certain decisions you make may be challenged later on, number one. And number two, remember that if you're providing any of these benefits, you're going to be looking to apply for tax credits and using some of your withholdings that would otherwise be required to fund these benefits. So because of that, you're going to want to make sure that you're following the rules and you have the documentation that's required to take those tax credits and to justify them. So on the first level, what the regulations say for all requests, this is the basic information that you should be getting. The name of the employee, obviously, the dates for which leave is requested, the reason for which leave is requested, and a statement from the employee that he or she is unable to work because of that reason. So, and this is going to be part of what you maintain for your records. It's also going to be part of what you use to make a determination on the leave request. You know, all of these things are going to be looked at, right? Is the reason for the leave, does it fall within one of those reasons that we talked about? One of the 5 reasons for emergency sick leave and the overlapping reason for emergency family leave. Is the employee willing to verify that he or she is unable to work because of the reason? They can give that explanation or certification, and you may have a discussion with them as a result of that. Maybe you decide that the employee can telework from home, that you have the availability to do that. So you're going to keep the employee working rather than give them this benefits. Next slide, please. So if, depending on the reason for the leave, in addition to that initial information, you're going to ask for a little bit of other information. If the leave is requested because the employee is subject to a quarantine or isolation order, obviously it makes sense. You're going to ask for the name of the government entity that issued the order. And again, as I said before, the application in this in Pennsylvania right now is very, very limited. So you're going to want to get this information and document it, even if you're going to deny the leave, because again, that'll be part of you maintaining records to show why you denied that leave. So you're going to want, if the employee comes forward and says, well, because, you know, this is because of the stay-at-home order that I'm requesting this leave, or this is because of the business shutdown order, and you can explain to them, you know, you'll document that, and you'll document your response to the employee, that if you, the employer, have laid your employees off or this employee off because business it can't continue, or because business is slow because of what's happening, then the reason why they're immediately not working is not the result of the government shutdown order or an isolation order or anything like that. It is for the reason of you've laid them off. If the leave is requested due to the employee's self-quarantine based on the advice of a healthcare provider or to care for an individual, you want the documentation regarding the name of the healthcare provider who provided the advice, who they're providing care to, those types of things. Next slide, please. And this one is probably, you know, again, as an employer, you're probably getting, most employers are getting many of these requests. And it's important that you document this. This is relating to the school closures or child care closure or unavailability. So you're going to want to get the name of the children or child that's being cared for, the name of the school that is closed or place of care that is unavailable, a representation that no other person will be providing care for the child during the period of leave. Remember, you can hold the requester to the requirement that they must be needed to provide the leave as opposed to some other parent or healthcare provider. And so the other interesting thing is you ask for the age of the children because if it is a child under 14, then if it's a child older than 14, I should say, that you can ask for why are there special circumstances exist requiring the employee to provide care. So basically what the law has built into this, not really in the initial law that was issued, but by the guidance afterwards, there's a presumption that if the child is 15, 16, or 17, that during daylight hours, the child could be home alone. And so therefore the employee would be able to work. Or either work in person or telework. Now, recognizing that not all circumstances would allow a 15 to 17-year-old to stay at home alone or not be directly supervised while the employee is working, that if the employee can provide an explanation of the circumstances that would require them to provide, you know, to watch and to provide care to that child. And again, you know, I don't know how deeply you're going to be able to challenge something like this, but you can at least ask for the explanation and you can vet that. The presumption for children 14 or under is that, yes, there doesn't need to be a special circumstance. If the employee verifies that they're needed to provide care and that they're the only provider that can do that, then they're going to be eligible for that benefit. But again, you want this information not only to make a determination on the request, but to maintain the records in that regard. And let's talk about tax credits. So what we just talked about in terms of the record keeping, that's kind of the basic record keeping that you're asked and required to keep in terms of benefit requests and making determinations on them in case those are challenged later on and you have the records. There's actually a little bit more that you're going to want to keep when it comes to the tax credits. And remember, the tax credits are important because if you're paying these benefits, the idea here, this is to be a net zero cost to the employer, and you want to make sure that you get the benefit of that. So you must retain appropriate documentation in your records and complete relevant IRS forms. You should be getting some advice from your tax consultants on this as well. I've listed some IRS guidance here, and I noted, for example, I mentioned before. So, for example, you're going to be taking the withholding that you would normally pay, the withholding amounts that you would normally pay on these benefits paid, and you can keep them. But again, you're going to want to make sure you have records to document, those calculations. If you pay out the benefits and the benefits that you pay out are in excess of what you can take from the withholdings, there is a way that you can basically take additional withholdings from other employees that you would be paying on your payroll, and you apply for what's called an advanced payment of employer credits due to COVID-19. So again, you're going to be ultimately applying for a tax credit when you do your taxes, but in certain circumstances, you can actually apply the form, you can complete forms, and you can actually take the credits. Even you can actually take withholdings to fund those general withholdings from your payroll within certain limits to fund the payments that you're making for these benefits. So again, the whole idea is for you to get actually as much money to fund this up front, and then ultimately any excess apply it to your as a tax credit, and you'll be reconciling this on your taxes. So again, you're going to want to get some tax advice with your tax preparer. There are certain forms that you need to fill out, and what the guidance is even, for example, remember we talked about the calculations of figuring out the number of hours an employee would be entitled to, and the pay rate that the employee would be entitled to for these benefits. Because remember, it's not just their hourly rate on their on their regular employment scale. I mean, it could be it could be a higher amount or a different amount once you factor everything in. Basically, those calculations, those numbers, that data should be maintained as well. So you should have a file for any employee who takes who gets any of these benefits. You should have a file where you have all these records maintained, both for the request itself, approving or denying the request, and also for the tax credits. So that concludes the presentation. I went a little bit longer than expected, but I will be happy to take questions. And even if you have follow-up questions, if time didn't allow for you to ask a question today, or you have other commitments to get to, you can certainly submit a question later on, either to me directly or to the chamber, and we'll try our best to answer that. I do also want to note that on the last slide here, we have my firm has their labor and employment blog. It's listed right there. It's free, and you're not going to get any type of crazy solicitation. We find it to be very helpful. It's been very active during this COVID-19 circumstance, and I would ask you to look at that. There is a question that came in: does an employer need to provide written documentation to employees certifying FFCRA leave? The answer is, I have not seen any formal guidance that requires a response. Now, there are plenty of forms out there in terms of an application form, a request form that have been developed. SHRM has a good form that they've developed for FFCRA requests. Our firm has some forms that we've developed. So certainly you should use a form, or at the very least, specifically request the information that the employee needs to provide. Again, you should internally document the decision making and whether it was approved or denied and why. There does not appear to me to be a requirement that there be written documentation provided to the employee, although I would say I would recommend that, because you've already gone through the whole process of making the determination. You're going to internally document it. If it's going to be challenged, it's going to be challenged. You want to make sure you have the right stuff in place. And I would say it makes sense to keep track of things that you would provide a written response to the employee. You can keep it short and sweet, simply telling the employee that the request is approved or denied and why. I have another question here. We have an employee on leave and we cannot get a response from them when they will return to work. Options? Well, there are quite a few options there. I mean, it depends a little bit on the the facts as to why the employee is saying they can't get back to you with a response, or if they're not responding at all. And in that circumstance, I would say that you should clearly make it known in your communications to the employee that you have work available to them, and that you are requesting that they return. And you're requesting a return to work date and information as to when they can return or why they can't return, so that you can make a determination. I mean, ultimately, I think if that employee, depending on the reason that they're out, you could potentially separate the employee. Or if the employee is saying that they have some type of continuing health reason why they're out. Now, I mean, typically in these situations, if the employee had suspected COVID-19 or actually had it, I mean, there's a recovery period typically, and they would be able to come back to work. Now, obviously, if there are complications, or what we're seeing as well are certain circumstances where employees are saying that, for example, they may have an underlying health condition that puts them in a higher risk category and makes them vulnerable if they come back to work. In those situations, you may have to a certain extent, and at least get more information and discuss that with the employee and engage in the reasonable accommodation process, and see if providing them additional leave may be reasonable under the circumstances. So it really does depend on the reason why the employee says they're out and why they can't come back to work. And I'll just add, if you have a circumstance where an employee is basically saying, I don't feel comfortable coming back to work, I don't have an underlying condition, I know work is available for me, but I'm afraid I'm going to catch something, and I'm afraid I'm going to give it to a family member. I mean, we can all have some compassion right now under these difficult circumstances, but that employee, it's up to the employer to decide. I mean, for that employee, the employer can say, well, we understand that, but we're doing everything that we're supposed to be doing to be preventative here. We have other employees who are carrying the water and working. We need you back, and if you can't come back, we're gonna have to separate you. Now, that employee may apply for unemployment. You would indicate to unemployment response that work was available for that employee, and the employee chose not to come in. Now, whether or not that employee will be determined eligible for benefits right now, they shouldn't be under the normal standards. But right now, a lot of things are up in the air with that. Another question: how do you calculate average rate of pay for salary workers? Hourly rate can be lower due to more hours worked. Well, I think the way you would calculate that is you would look back over the 6-month period, right, or a shorter period if the employee wasn't there that long. And what you would do is average out their pay, again, because the idea is to capture potentially additional pay that was made to that employee, bonuses or things like that. So, if the employee makes, let's just make this easy. If the employee makes $1,000 a month salary, I'm using that for easy math, and they haven't been paid any extra, Well, if you go back and look over the 6-month period, they're going to be paid, they're going to be paid $6,000, or let's make it $1,000 a week. If they're paid $1,000 a week, you're going to go back and look over the 6-month period, and whichever way you do it, whether you take their full pay and calculate it by, you wouldn't really be, doing it by hours in that circumstance, right? Because we don't track the employee's hours. So I think in that circumstance, you're basically going to use their salary amount. I'm not sure if they've received extra payments. I'd have to look back at that. My guess is that probably gets factored in again if it's like a bonus. So you would probably do it like kind of on a daily average rather than on an hourly average, if that makes sense. I think that's all the questions. Thank you everyone for participating, and I hope everyone continues to do well, and things start, when they start to open up, that they can be done so safely. I will be working with the chamber down the road on another presentation, and hope you can join us then.
Great. Joe, thank you very much. It was very informative. Thank you to everyone on the call today. On behalf of the Greater Scranton Chamber of Commerce, please keep an eye out for additional programming that we'll be bringing you over the next couple of weeks. Just wanted to bring you up to speed on what we have on Tuesday, May 12th. Drucker and Sacchetti will be doing a program on Paycheck Protection Program, really what to expect during those 8 weeks. And then we'll have Joe returning with us on Thursday, May 7th, to talk about returning employees to work after, I'm sorry, not the 7th. I believe that's the 14th, and returning your employees back to work after COVID-19. Okay, thank you all and have a great day. Joe, thanks again.
Thank you.